Social Welfare, Professor Ali Pate, has reaffirmed that universal health coverage is a top priority for President Bola Tinubu-led administration, reiterating the administration's commitment to ensuring that every Nigerian, regardless of their location or economic status, has access to quality health care. Tonight, the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, joins me on the program to speak on his strides thus far as the man in charge of the nation's health sector, but particularly his focus on primary health care and expansion, impact of 2025 federal health budget, and $1 billion HERB program, health insurance matters, enhancing incentives for healthcare providers, and more. Prof, good evening to you. Thank you very much for joining us on Politics Tonight.
Thank you for having me.
Right. As you know, this is Politics Tonight. So before we discuss new developments in the Nigerian health sector, it's important for me to get some clarification about what is happening in your home state of Bauchi State. The political atmosphere in your state has become charged with contrasting narratives. We have seen a war of words in the press between the Bauchi State Governor, Bala Mohammed, and Foreign Affairs Minister. The minister is accusing or has accused the governor from promoting North-South divide. But what we hear is that this is all about the Bauchi State governorship after the current governor leaves office in 2027. Interestingly, also, you seem to have a very different type of relationship with the governor, Bala Mohammed of the PDP, despite being a stalwart member of the APC. What is your take on all of this?
Well, thank you. I think you have to understand that Bauchi is a significant state, politically, economically, and socially, given where it's located in the northeastern part of the country. And in reality, the state is fundamentally a progressive state over many years. Unfortunately, in the past, rancor among the political elite had tended to undermine the progressive wing, really making the headways that they ought to have. And so our approach is that of moving away from rancor, but rather unifying the party so that it's a solid platform to support the important strides and the reforms that the president is making nationally in his role as the president and also leader of our country, so that the state keys into that. So our focus is really on unifying the party. As a leader, one of the leaders in the party, my focus is to ensure that we're unified, that we have a strong platform, that politically the progressive ideology essentially results in that being translated into political victory for the party in 2027. That's what we're working towards in, day out. And we're focused on delivering at the national level on the task that the president has granted to us, which we're doing and will continue to do so. The time for other issues will come, but for now, our focus is really to deliver for the president, deliver for the country, and unify our party in Bauchi so that at the end of the day...
You're trying not to answer my question. What's the reason for this discord between both men? You have a good relationship with the governor. What kind of relationship do you have with the minister?
I have a very good relationship with all my colleagues, and that's something that I cherish and I also work on, because it's not personal. Service, in whatever position you find yourself, you do the best that you can. The governor was at some point in the same party as ANPP, is where he served as a senator, and who knows what tomorrow might be. He might leave from PDP to APC. So for me, it's really focusing on development, on bringing, delivering on the mandate that we currently have, but also for Bauchi, what is it that will translate into development for the people of Bauchi State. So it's not about personal animosities and other parochial things. That's not my style. And okay, my focus is really to see what we can do to build, not to really divide the polity in Bauchi.
But given your performance at the center, can we expect you to throw your heart into the ring on behalf of the APC in the 2027 governorship contest?
Can you say that again?
Given your performance at the center, can we expect you to throw your heart into the ring on behalf of the APC in the 2027 governorship contest?
I think for now, I'm focused primarily on delivering the mandate that His Excellency President Tinubu has granted me. It's an opportunity to serve, that I'm glad to have this opportunity to serve. What comes in the future, when the time comes, I think we'll make a determination. The stakeholders in Bauchi right now are working towards unifying the party so that we have a strong platform at all levels that we can deliver for the president, deliver for the party, and deliver ultimately for the state.
So there is a possibility that you contest for the governorship race in the 2027 governorship election. Is that it?
I think we are very closely connected with the grassroots in the state. And I think the issues facing the state are very clear. But it will not come to be if the party is not united. And my singular focus is to unify APC in Bauchi, to support the president to achieve what he is trying to achieve now, and also what comes off in 2027. Now, as to what happens at the state level, and I hope that the state stakeholders will align so that we have a successful alignment between the president's success and also what happens at subnational level. So yes, over time, over the next several months, we'll see where it lands. I'm ready to serve, but it's also with a mission to develop the state, but also to develop our country. So I have not made a determination one way or the other.
All right. I will also be here to monitor that development. So let's talk about the health sector. The president has just signed the 2025 budget into law last week. And what we know that healthcare was given an additional boost of 300 billion naira for HIV/AIDS care support for Nigerians, and on top of an over 2 trillion naira allocation to the sector. In fact, recently the Federal Executive Council announced the $1.07 billion fund for human resource development and other sectors, other health sector reforms. So what can you tell Nigerians about the impact of these funding allocations and how it will impact their lives? Well,
for the last year and a half, we've seen this administration focus steadily in rebuilding Nigeria's health system, transforming it. The designs have been well developed and implementation had begun, and we already have early results, positive progress, positive momentum between federal government, states, local government, and other actors. In 2025, we're going to see an upscaling of that. There are some important projects that we have taken on, for instance, expansion of our cancer centers. Those will be completed. The first 3 will be open in May 2025. There will be more to come. Revamping our health infrastructure at the teaching hospitals, federal medical centers is also underway. That is coming out of this year's budget. The medical relief program that the president has put in place as well to reduce the cost of pharmaceuticals and consumables will come to being in this year. Project Hope is trying to align federal government, states, and local government to invest in primary health care. So an incentive system is performance-based financing, which is concessional, which will allow states to recruit frontline health workers to improve immunization, provide maternal and child health services, and other critical health services in their population. So Project Hope is a major, major contribution that this president has approved for us to ensure that we deliver the basic services for Nigerians, in addition to expanding health insurance. As a consequence of the U.S. government's change in policy, obviously we had to look inwards and say, look, we appreciate what the U.S. government had done over the last 20, 25 years. But at the end of the day, we can also use this opportunity to exit the dependency which has characterized over the last 2 decades. And thankfully, this budget includes a provision for plugging that hole, at least on the U.S. government side, in terms of HIV treatment, tuberculosis treatment, malaria treatment, so that Nigerians, our 1.6 million Nigerians who are on antiretroviral therapy, will not lose the opportunity to continue to live and thrive because of the change in U.S. government policy. While at the same time, we expect to still reset and forge a stronger relationship with the U.S. government in other ways, in health and in other arenas going forward. So we're optimistic, and we're using this opportunity really as an opportunity for growth for our country, so that we exit from dependency and work towards self-sufficiency over time, using our domestic resources, concessional financing, and ultimately the crafting partnerships creatively that can help us advance the agenda of health, which is one of Mr. President's agenda for the country.
All right, Honorable Minister, and I'm sure you know your performance in office attracted the attention of high-level opposition recently. Former Vice President Atiku Abubakar stated that this $1 billion fund does not include any plans for enhancing health infrastructure. And in his words, he said claims of animals such as snakes, termites, gorillas, and monkeys swallowing public funds must never be the fate of the funds budgeted for the critical sector of health in the 2025 budget. What do you say to the critics, and are there concrete plans to deal with our health infrastructure deficits?
Yes, we listened carefully to the statement issued by His Excellency, the former Vice President. He's an elder, he's a statesman, and we will not take issues with him directly. All we know is that we are focused on rebuilding a health system that has been invested for a very long time. Over the last several months, we have revamped primary healthcare infrastructure. More than 800 have been completed all across Nigeria, revitalized, and at least 2,000 are in various stages of being revitalized. These are infrastructural improvements. Our teaching hospitals, for the first time in this country's history, we established 6 major cancer infrastructural facilities and equipping them, and 3 of them will be open in May. And there are so many other upgrades in our physical infrastructure, in the health facilities, and in equipping those facilities, because for a very long time, Nigeria had not really invested the way it should have. So that is what we're trying to do. And the attention that is good, I'm sure that there are others who may be a bit fearful that President Tinubu is succeeding, because I believe that the president's success may not always be comfortable for everyone. But we are convinced that's the right thing for this country, to take care of the population, make sure that the infrastructure is there, the equipment is there, and the people that run those facilities are there, and the commodities are there. That is what we are working towards day and night. And we will not be distracted
Honorable Minister,
by criticisms.
There are some Nigerians who do not think the former vice president was out of line, because truly Nigerians deserve to know the details of these loans and how the funds will be spent. I mean, he's saying that the budget should be accompanied by a clear policy framework explaining its disbursement and how over $1 billion will be spent in the primary health sector. And that's not, too much to ask for. Let's move on. In the 2025 health budget, your ministry is allocating significant resources to a federal medical relief program. How does this work? And is it reliant on imported medicines?
So first of all, back on Project Hope, on the issue of a policy framework, I think if people are honest and they've listened carefully as to the narrative we've been building over the last year and a half, we went to the National Council on Health, brought federal government, states, and local government, and agreed on a sector-wide program. Okay. The President unveiled the Health Sector Renewal Investment Initiative in December 2023, and all the 36 state governors signed up to that with the ask and the offer and the accountability measures that we will cooperate between the federal government, all state governments, and local government to put Nigerian people's health at the center. Project Hope is a direct derivative of that collaboration across all levels. The policy framework is clearly laid out, has been consulted widely, and in the project appraisal document for Project Hope, which is out there publicly available if people care to read, it is laid out what it sets out to achieve and what results we should expect to achieve, what incentives and what resources will flow to the states as incentives. And no surprise, almost all the states in the Federation have written explicitly asking to be part of this great initiative that His Excellency President Bola Ahmed Tinubu approved for the health sector, so that the health of Nigerians should be attended to, and we should collaborate, build in the synergies across all levels of government to get there. Now, the medical relief program, as you know, we had a People's Voices survey which showed that Nigerians were hurting because of the cost of accessing the healthcare services, cost of drugs, cost of consumables. And last year, Mr. President approved a medical relief program, which is an initial provision for commodities, essential drugs. And this year in 2025, a major expansion of that effort, which will buy from local manufacturers commodities, antibiotics, antimalarials, and other essential drugs for hypertension, diabetes, pull them, package them, and distribute them through the 8,800 primary healthcare centers, through 37 general hospitals in all our states and the federal teaching hospitals. And those will contribute directly in lowering the cost of access to services to bring relief to our population. Right. That is what we're about. That is a solution to the problem that we have understood and we've seen. And this is in the overall same direction with many other efforts that the president is really putting in place to bring relief to the Nigerian people as we walk through these reforms that have been difficult, but they are taking our country in a dramatically different and positive direction.
All right, Prof. Now let's talk about other troubling health matters. Nigeria has the highest burden of mother-to-child HIV transmission in the world. And according to a report by the United Nations, 140,000 children aged 0 to 14 are living with HIV in Nigeria, with over 20,000 new infections and 15,000 AIDS-related deaths recorded annually. How committed is your ministry to scaling up prevention, testing, and treatment services across the country?
Well, working with with NACA, which is the agency responsible for HIV in terms of the prevention, the multi-sectoral response, and the Federal Ministry of Health, we're expanding testing of pregnant women when they come to take their antenatal care, so that those who are tested are also treated, and to provide those medications so that we can reduce the mother-to-child transmission. And guess what? In fact, there's been tremendous improvement in Nigeria's performance in reducing mother-to-child transmission between 2022, 2023, and where we were in 2024. We've seen dramatic increase in terms of the proportionality of women who have been tested and who receive treatment. And that is positive. And there are many other elements that will continue, and engaging our traditional religious leaders to continue to advocate for prevention. Her Excellency, the First Lady, launched the Free to Shine campaign already in the North Central and in the Northwestern part of our country. And this is an effort to mobilize other stakeholders to add to their voices, our young ones, to know to get tested, get screened for HIV, for syphilis, for hepatitis, so that we can be able to treat them. So all of those are happening in tandem, and we're seeing tremendous progress and momentum building in that direction.
So when it comes to state governments, how committed are they? Because according to a report last week, state governments have been urged to increase funding for HIV, syphilis, and hepatitis program. Do they understand that this is a call to action for stakeholders to mobilize resources, strengthen advocacy, and implement sustainable health programs across the country?
Well, we signed a compact with all the 36 states, and since then we've seen tremendous cooperation with the state governors through the Governors Forum and individually. Over the last 10 days, I've visited at least 8 states in our country. Most recently in Akwa Ibom State, I have been to Bayelsa, Sokoto, and many others. What I have seen is a tremendous willingness of our state governors to join hands with the president to co-invest in areas that will affect the health of Nigerian population, particularly the poorest and most vulnerable, women, children, and those who are afflicted by infectious diseases like HIV. So I'm confident that if we continue in this direction, that collectively, different levels of our government will be able to address some of those needs that exist. It's not easy, but I'm seeing the political leadership really manifesting itself very well.
Prof, I want to take you up on Nigeria's counterfeit drug epidemic, the impact of fake drugs on the health of Nigerians. Stakeholders in the drug supply chain and pharmacists say in recent years they have had to double their verification on the authenticity of medical products. What's the Ministry of Health doing about this?
You would have seen the tremendous work that NAFDAC has been doing recently, with huge support from the National Security Advisor's Office, with NDLA, with the Pharmacy Council of Nigeria, deliberate effort to close the open drug markets, which have been one of the areas that have contributed in the proliferation of those counterfeit and substandard medicines. That's a very sensitive area, but that has been one that we've focused collectively through our agencies to work diligently in trying to fix, and we're seeing those numbers go down. The Pharmacy Council of Nigeria, of course, also is doing well in terms of regulating the distribution of pharmaceuticals. But professional associations, the Pharmaceutical Society of Nigeria and others also have their roles to play. and subnational governments. In fact, we had written to all the state governments to inaugurate their state task forces to deal with these counterfeit medicines, and so that we have standing task forces in the states. At the end of the day, it's about the safety and the efficacy of the drugs that get to our population.
And talking about safety, Prof.
Nigerians,
Prof, talking about safety, because
yes.
Professor Adeyege has raised the alarm over threat to her life and the safety of the agency's official. Is the federal government taking this seriously? Is Prof and her team getting the needed protection they need?
Yes, I think we're focusing very much on the safety of the pharmaceutical products that are available in our country. If I got your question correctly, NAFDAC itself, I think, has got a lot of support in terms of the safety of those of its staff that are also trying to enforce the regulations.
And really, I mean, you know, the drug market is a complex global trade, and reportedly India and China are the biggest sources of illicit medical product that gets into West Africa. Why has federal government failed to block them?
I think there's a whole chain. We're stamping it from the point of view of entry, but also from the point of view of those that are manufactured here, contracted here, but also distributed here. I think more than 90% of those that we already have in our country, I think NAFDAC will certify that they are safe. Now, the few that are not, it's sometimes outside the control of NAFDAC directly. It may be at the borders and others, and surveillance is ongoing to ensure that we sense and we're able to respond where there are those counterfeit medicines in the markets. Yeah.
But what's the federal government doing to root out corrupt operatives who allow the importation of fake and substandard drugs into the country?
That's a systemic issue. At least from our side, the Federal Ministry of Health and our agencies like NAFDAC and PCN, we've sent the message very clearly. Zero tolerance, but also putting in managerial practices to ensure that, in fact, there is all alignment in terms of that direction to ensure we enforce the rules and regulations against counterfeit medicine. And we're seeing the positive result of some of the work that NAFDAC is doing. And it goes across government, including, like I mentioned, the NSA's office and other parts of government that are all looking into this particular agenda, because it goes beyond just health. It's also a national security issue. So I think we just have to continue to also educate Nigerians to really understand that it's harming our national interest, not only from the health side, but also even our ability, and the manufacturers that are able to manufacture in our country, they will be undermined unless we're able to clean up the spaces, because they undermine the market position of those who are genuinely and honestly trying to manufacture local commodities, generic drugs and other products for our population, but also for export, potentially to other parts of the continent of Africa.
All right. Let's talk about another very interesting issue. February 28, 2025 was Rare Disease Day, an international advocacy day established to bring widespread recognition of rare diseases as a global health challenge. You know, these diseases affect millions worldwide, yet each condition impacts only a small percentage of people, leading to delayed diagnosis and limited treatment options. Prof, you know, many rare diseases like lupus, myasthenia gravis are autoimmune in nature. Raising awareness is key to improving research, support, and access to care for those living with this condition. Is the ministry paying attention to increasing understanding of rare diseases and the problems facing Nigerian patients?
Please, can you say that once more? Because I was having an issue with the earphone.
You're hearing me? All right, let me repeat myself. I was talking about February 28, 2025, which was Rare Disease Day, an international advocacy day established to bring widespread recognition of rare diseases as a global health challenge. You're aware, Prof, that these diseases affect millions worldwide, yet each condition impacts only a small percentage of people, leading to delayed diagnosis and limited treatment options. And I was reading out these rare diseases. Talk about lupus, myasthenia gravis. These are autoimmune in nature. And raising awareness is key to improving research, support, and access to care for those living with these conditions. Is the ministry paying attention to increasing understanding of rare diseases and the problems facing Nigerian patients? Did you get that, Prof?
Yes, I did. And as you know, there are non-communicable diseases that are growing as a burden of one of the fastest growing segment of our burden of disease in Nigeria. And we're working as a ministry to expand awareness, promotion, and prevention of those diseases through our specialty hospitals. Other diseases like the immunological diseases you've mentioned, or some neglected tropical diseases, through our public health interventions, we're trying to address them. But there are also other diseases that are much broader, more prevalent, that we have to tackle, whether it's measles or diphtheria or hypertension and diabetes, some basic things to get them out while trying to improve the awareness of our population and our providers in terms of tackling, diagnosing those rarer health conditions. But at the end of the day, malaria,
Prof,
measles,
I want us to focus on this
pneumonia,
particular... Prof, kindly hold on. I want us to focus on this particular issue because there are many Nigerians living with these diseases but do not even know what is wrong with them. And I'm sure you're aware of the fact that Nigerians continue to be a victim of late and misdiagnosis of rare diseases, including poor treatments that have increased the number of casualties in recent times. So my exact question is, are there special considerations to Nigerians living with rare diseases? Do we have formulated policies that will drive equitable access to diagnosis, treatments, and quality health care? That's the question.
Yes, I think you'll agree with me that if we move faster towards universal health coverage, whatever conditions people have, they will be able to get them tested, diagnosed, and catered for. We're way behind in terms of getting that universality in terms of coverage. But what we're trying to do is to say, where is our largest burden of disease? Where is the greatest good for the greatest number that we can be able to accomplish? And how can we prevent those diseases that we know can be prevented? How can we make our hospitals ready to be able to test this and our specialists to be able to pick those rare diseases and attend to those who are afflicted by them? And I think that's the balance that we're trying to make. There are thousands of children that are dying of measles, of malaria every day. And those children, we can prevent them with simple, efficacious interventions. The rarer diseases are also important because they afflict Nigerians. And we need to make sure that the hospitals are able to test them, the providers know how to look for them, but also when they are found, be able to provide support to Nigerians who are suffering from those rare diseases. Some of them require treatments that may not necessarily be available in our realm.
Absolutely.
And those are limits that we have given our fiscal position and our health financing situation. But at the end of the day, we're moving steadily in improving the investments in health to get to the point whereby even...
Welcome back to Politics Tonight, everyone. Thank you very much for staying with us. Professor Mohammed Ali Pate, Coordinator Minister of Health and Social Welfare, is my guest tonight as we focus on primary health care and expansion, impact of 2025 federal health budget, health insurance matters. Thank you so much for staying with us on the program, Prof. Now let's continue this conversation. You've committed to working with state governments in an effort to increase the number of primary health facilities nationwide. You talked about increasing from 8,000 to 12,000 within the next 3 years. Are we actually on course for that? How do you ensure accountability and are states and local governments truly cooperative?
Yes. So we do believe that the target that we've set for ourselves is achievable if the states work with us as they have started over the period that is ahead of us. In the last year alone, more than 880 primary healthcare centers all over Nigeria have been revitalized, and more than 2,000 are in various stages of being revitalized over the next 12 months. This is a partnership between the federal government and the states and local government to get them functional, so they are level 2, so they can provide services. And that needs to continue over time. Now, that's really an important step. In terms of accountability, we have agreed matrices for performance the joint review, and very soon we'll be launching the State of Health report to show how every state is doing, so that we are laying out the facts and learning what is working well and what is not working well. Very soon, His Excellency Mr. President will be launching the National Health Fellows Program, where we have recruited very brilliant young Nigerians from each of the 774 local government areas of this country to help with the independent accountability checks in some of these primary healthcare centers, some of the health assets across our country. So yes, it is an audacious target, but we have seen progress in that direction.
And during our previous conversation, you also added that these PHCs will be linked to a comprehensive emergency care center. Are we on course for that?
Yes, we are. There are more than 158 facilities that have been empaneled by NHIA to be able to provide free emergency obstetric services for Nigerians as part of our effort to reduce maternal mortality. That is a major step that we are trying to take away the barrier for women accessing these emergency services that they need.
All right. So also recently you informed Nigerians that 2.4 million Nigerians enrolled in health insurance coverage under the NHIA in 2024 alone. Now, with millions of Nigerians still not covered, how do we expand the progress that is being recorded while also guaranteeing practical access to affordable care?
So it's a great start. I mean, if we had been doing 2.4 million per annum over the last 20 years, there will be at least 50 million Nigerians now that are health insured, which is not where we are. But at least we've changed the trajectory. And we've increased the tariffs so that providers get better paid when they provide services. But at the end of the day, health insurance, someone has to pay the premiums. And so in 2025, federal government is already allocating some additional resources for catastrophic health insurance fund for the most expensive types of services. But we're also increasing the vulnerable groups fund with significant resources to cover more Nigerians, more poor and vulnerable, while expanding private insurance so that people can opt into buying additional coverage for themselves, for their families, in line with the mandatory health insurance that the NHI Act of 2022 has provided for. So this is a journey, and Nigeria is steadily making progress in that journey. It will take time, given the deficit of almost 2 or 3 decades that we have not made the progress that we should be making. But we are now beginning on that journey, and we're seeing improvements in terms of the coverage.
But also, you know, the NHIA announced that the federal government had approved a more than 90% increase in capitation fees and a 378% rise in fee-for-service payments. You have said this will enhance quality of care, but how do we ensure that care providers will use the new resources for facility upgrades and, you know, perhaps enhanced service provision rather than profiteering?
So first of all, the background is that for almost 12 years, the premiums that people had been paying had been static. An actuarial analysis was conducted, and the consultation with the providers and NHIA reached agreement in terms of these increases in tariff. And given the individual choice that we're trying to weave into this program, if a provider collects those tariffs and is not able to provide the quality care, I believe that populations will also vote with their feet. At the end of the day, NHIA is the regulator and is a purchaser of healthcare services, and it has mechanisms to ensure that the billing that the providers are making is consistent with the quality that is expected for them to provide to their population. That is why it's important that NHIA becomes a strong regulator of health insurance in Nigeria. So we're steadily changing that path in a way that will ultimately deliver affordable, quality healthcare for Nigerians who are enrolled.
Let's talk about health workers, the people who do the actual work, so to speak. And one thing Nigerians lament is the morale and attitudes of many health workers in the country. You emphasize the need for workforce upskilling and recruitment enhancement. What has been done in this regard, especially in the rural areas where skilled birth attendants, for example, are hard to find for a population of our size?
The fact is that there are many hundreds of thousands of health workers in Nigeria who are very motivated, very diligent, and working extremely hard, sometimes in not easy circumstances, some in rural areas, some in urban areas. I saw some of them when I traveled across the states, and we appreciate them. Over the last year and a half, we've tried to streamline the waiver process so the recruitment of health workers into health facilities has improved. More than 4,000 healthcare workers, just by the federal government alone, through our federal hospitals, have been recruited to provide services. The retraining of frontline health workers, which we announced of 120,000 in 3 years, already more than 60,000 have been retrained in 35 states. Edo State is going to start at the end of next week, actually, so that we have all the 36 states on our way to retraining 120,000. That is the first time that many of them have been retrained clinically in the last 10 years. There are other measures that we're working towards improving their working circumstances. President approved the increase in retirement age, for instance, from 60 to 65, so that we retain some of the skilled clinical professionals to teach others as well as to provide services, even if we have to follow due process through the Council of Establishment to conclude on that. So there are many efforts, in addition to the working environment, the infrastructural upgrades, so that health workers in Nigeria would have the environment that will allow them to deliver what they are in there for, to deliver services to Nigerians.
All right, that sounds very interesting. We'll come back to that in a moment. You know, the president says it's focused on leveraging the economic potential of every sector to create jobs and tax revenue for public service delivery. What kind of investments interest are you seeing in the health sector now? And what efforts are you making to drive interest in that area?
A lot of interest from investors globally, from the West, from the East, from Europe and other places, and also our own domestic private sector showing tremendous interest in this. Through the presidential initiative to unlock the healthcare value chain, at least 77 investment cases have been developed. 7 are in the advanced stages. They are going to be signing the term sheets for their deals. We expect that in the next couple of months. Some have already started manufacturing. At least I know that the test kits manufacturer in Lagos, Codex, is already in place and is expanding. We've seen a beta-lactam plant in December 2024 that I flagged off in Lagos, which will manufacture antibiotics, beta-lactam antibiotics like Augmentin, amoxicillin, clavulanic acid, which is the equivalent of branded Augmentin. So we're seeing a lot of interest. There are actors from China, there are actors from Europe, there are actors from the United States who are looking at the Nigerian market. The Minister of Industry, Trade and Investment has been a key partner alongside other colleagues who have been working with us, the Coordinating Minister of the Economy and Minister of Finance, to see that we put in place mechanism that eases the entry of major manufacturers. One of the largest manufacturer of treated bed nets is coming to Nigeria to invest in setting up a plant in Lagos. And that will be a plant that will produce treated bed nets that will serve us for fighting malaria, but also can be used to be exported elsewhere. We ratified the Africa Medicines Agency Treaty. I mean, that approval has been granted. We're now working to ensure that it's actualized so that we deposit the instruments. And that will mean that made in Nigeria goods will have the status of made in Africa goods, so expanding the economic space. So a lot is happening in that direction as envisioned by the president.
All right, we hope that comes to fruition. But earlier you mentioned that in the year 2024, your administration has retrained over 53,000 health workers. And you say you will retrain over 60,000 in 2025. Prof, you refer a lot to the need for improved human resources in the sector. But the recent launch of the National Health Fellows Program solve our brain drain issues in the sector. And what do you expect to achieve with this program?
Well, the retraining is one aspect so that those who are already there are equipped. But we've also expanded the quotas for training across different professions. And the accreditations are being done by the regulators to ensure that we don't trade that for quality. It will take time. If you recruit a medical student today, for instance, it will take at least 5-6 years before they graduate, and then a few more years before they become specialists. So this is a long-term journey of revamping, the retraining of health workers so they can get into labor force, so that even if some leave, some will remain in our country. So we're tackling this issue of brain drain from multiple angles, increasing training, trying to retain those who are trained, distribute them in a way that serves the needs in rural areas, improving their working conditions, and also the just capacity for them to be able to deliver services that are needed in our facilities. So it's from all angles that we're trying to address this issue of shortage of health workers.
But for a country that has not really done well when it comes to health research, I mean, it's been a year since the National Health Research Committee was inaugurated to play a crucial role in providing health research direction. The person chairing this committee is someone that is, known globally in the world of research, likewise other members, and I'm talking about Professor Olufemilayo Pate. How has the committee been able to facilitate collaborations across various health disciplines and institutions in the country?
The Health Research Committee has been known tremendous input in terms of the policy direction of the health sector we have in the last year and a half. And folks like Professor Fumi Olopade and her colleagues, many of them brilliant Nigerians that have excellent track record all over the diaspora in the US and other places, have contributed in understanding the landscape of research, building the capacity of our researchers to ask the questions, apply the methods, find what is most relevant, how we regulate the research activity also in our climate, and mobilize resources, some of which is grant funded. Now, with the changes, for instance, in the US policy, obviously that has some implication, and we have to figure out how domestic financing can be mobilized to strengthen research and development and innovation in our own country, because we cannot rely perpetually on outsiders to fund the research that is in our country, that will be necessary for the transformation of our country. So that is still work that we have to do collectively, and we really appreciate the Nigerians in the diaspora as well as our scientists, academics here in Nigeria, who have been really working very hard to ensure that Nigeria's best foot is put forward in the research for health agenda. The clinical trials is another area which is very clearly an area that we had not invested much in, but we're seeing a path where we can be attracting clinical trials to Nigeria that will further refine the capabilities of our health workers, but contribute in knowledge, but also new products, including commercialization of products that may be developed here in Nigeria. It's a long journey, but at least we've started on that path.
And hopefully we'll get there. Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, thank you so much for speaking with us on Politics Tonight. And as always, we wish you the very best. Thank you so much.
Thank you. Thank you.